In this video today, we're going to be talking about the secular models of counseling.
As pastors, we're often asked what we think of psychology or psychiatry. Unfortunately, as pastors, we often don't really know what it is. Our opinions are often based on decades-old information or old stereotypes of some German guy with a beard talking to somebody on a couch. The truth is that psychology and psychiatry methods have progressed a very far way. And there is not simply one view or one school of psychology or psychiatry, but there are actually many. And many use a combination of these methods. So no two psychologists or psychiatrists use the same methodology. Now, included in the link section of this lesson are some examples of the three basic schools of psychology and psychiatry: the Gestalt school, the rational school, and the emotive therapy school. And I hope that you'll take the time to look at those. We're going to talk a little bit about who they are. Now, the purpose of this is not for you to agree with all of it, but is simply so that you have a better feel when somebody asks you that question, what they think of psychology or psychiatry, about what it actually is. It's important that we understand what our parishioners are saying to us when they come and talk about having therapy or wanting therapy. It's very important that we understand what is meant. So with that purpose, we're going to review the three basic schools of psychological therapy. Now, I briefly covered the three basic schools of psychological counseling with you today. But the links that you see will give a much better and much clearer picture, I think, as well as examples of what these methods are. I hope that you will watch them. It would be a good idea to see this video first, however, so that you know what we're talking about. But I do hope as you look at them that you will learn from them. You don't have to agree with everything, but watch how they progress. I think there might be something here for you to learn as well.
Now, there are many forms of counseling in psychology, but we're going to be discussing three main broad types of counseling. The first one is called Rogerian counseling. It was started by Carl Rogers, and it focuses primarily on the feelings. Feelings are the key to everything else. The second type of counseling is cognitive counseling, which was started by Albert Ellis, in which thought is seen to be the key to feelings and to actions. The third kind is called behaviorist or Gestalt therapy, and it focuses more on the actions instead of on the thought. Now, Rogerian counseling was, of course, started by Carl Rogers, who is the man you see pictured here. It is non-directive, which means it does not give people advice or judgment about what to do with their life. Instead, it helps the person to explore the feelings they have about what is happening in their lives. It does this by adding leading, feeling-oriented questions. Part of Rogerian counseling is to learn how to be a good listener. It aims at getting patients to share their feelings. And it emphasizes listening skills and empathy. It usually takes a lot longer than other forms of counseling because it takes longer to explore one's feelings. And it encourages the patient to solve their own problems rather than trying to give any formulas about how they might be able to solve their problems. Rational cognitive therapy was started by Albert Ellis, or at least championed by Albert Ellis, who is the man you see pictured here. It is probably the most common approach that is used by counselors today. It is directive and not non-directive. Instead of saying, how do you feel about things, it directly confronts thoughts that are considered to be inappropriate or wrong. It gives advice. It makes moral judgments. In cognitive therapy, people learn to make rational choices about how they will behave. It's emphasized that people choose what they want to do and they choose based on their thoughts. It confronts patients with the consequences of their choices. Rational cognitive therapy is used and modified by many Christian counselors today, as well as secular counselors. And it changes people by changing their presuppositions. It explores the unwritten rules or laws by which people live their lives. The last of the three is behaviorist therapy, or otherwise known as Gestalt therapy. If you notice, we have a picture of a goblet or two faces. It depends entirely on the way you look at it. Gestalt therapy emphasizes the fact that many times we look at things backwards. In Gestalt or behaviorist therapy, actions change thoughts and feelings, not thoughts and feelings changing actions. This is the reverse of the way people normally think, but it is rather what we do that affects the way we feel or the way we think. So the counselor will sometimes provoke the counselee to actions to demonstrate their effectiveness. It is not unusual for Gestalt therapists to provoke a person into arguing with them so that they can understand that it's okay to argue, for example, or to laugh to understand that you can be in a good mood through laughing and not just because you laugh because you're in a good mood. It focuses on changing learned responses. It indicates the fact that you can learn to respond or to act in a different way when you're confronted with a certain stimulus. It is often used in the treatment of addictions and phobias and anxiety disorders where people behave impulsively because of some stimulus in their life. Meditation, primal scream therapy, which is sort of way out there, or an assertive training all have their roots in Gestalt therapy. In most modern counselors, medication and therapy are used together. Counselors will usually send their people to a psychiatrist or a medical doctor to receive medication as well as having therapy with them.
Now, I briefly covered the three basic schools of psychological counseling with you today, but the links that you see will give a much better and much clearer picture, I think, as well as examples of what these methods are. I hope that you will watch them. It would be a good idea to see this video first, however, so that you know what we're talking about. But I do hope as you look at them that you will learn from them. You don't have to agree with everything, but watch how they progress. I think there might be something here for you to learn as well.